Woo! God, this is fun. Okay. Hello, my rainbow joys. It is Delia. How are you? It's good to see you. So, a lot of what we're going to be talking about on this channel has to do with gender affirming care and trans health. And today I just wanted to start by explaining what gender affirming care is. I think there's a lot of misconceptions out there about what gender affirming care is, what it looks like, who it can be provided to, and I wanted to talk a little bit about that. So, as a disclaimer, first of all, this is not meant to be medical advice. If you need medical advice, please go see a healthcare provider. Second disclaimer, this is not all of the information that is out there about gender affirming care. This is just a really broad overview of gender affirming care. We're not going into the nitty-gritty details today. I'm just giving a general overview. With that being said, let's talk about gender affirming care. So, very basically, what is gender affirming care? So, gender affirming care is healthcare provided to a person who is any sex or any gender that affirms or reaffirms who they are and helps them to better feel comfortable and safe in their own body. So gender affirming care can be provided to trans people, it can be provided to cis people, it can be provided to men, women, intersex folks, males, females, DSD folks. Intersex and DSD are sometimes used as interchangeable terms. Some people have preference for one term over another. Some people prefer neither term. It's a very individual thing. On this channel, I use both terms just to be more inclusive, but each person has their own preference. Any person can receive gender affirming care. It is not exclusive to trans folks. But gender affirming care has come up more specifically in terms of the trans, non-binary, and gender non-conforming communities. So why is that? A lot of the gender affirming interventions that cisgender people receive have become normalized throughout the course of medical history. So just to give you an example of this, plastic surgeries like liposuction and breast augmentation and buccal fat reduction, things like that, those are considered gender affirming surgeries. And those are things that cis people can receive, right? There are other interventions like erectile dysfunction medication and hair loss medications. Those are also examples of gender affirming care. Okay, everyone with me so far? That's not even scratching the surface. There are plenty of other gender affirming interventions that cisgender people can receive. The reason that it is highlighted so much in the trans, non-binary, and gender non-conforming community is because we receive care, gender affirming care specifically, that allows us to be affirmed in a gender that does not align with the gender that we were socialized as. Just to give you an example, I was designated female at birth, meaning that when I was born, the doctors looked at me and said, oh, okay, this is a female, so you can socialize this baby as a girl. And I was raised as a girl. I developed all the parts that a female would be expected to have. But as I got older and figured out that I'm trans, some of those things felt right to me and some of them didn't. Some of the ways that I was socialized as a girl felt right and some didn't. So I ended up having what is called a gender affirming mastectomy, or top surgery as it's known in the community. And what that meant for me was removing as much of the breast tissue from my chest as possible. And I did not keep any of the external features that you would expect to see on a feminine chest, because to me that was not affirming. That did not make me feel safe in my body. So when we talk about gender affirming care for trans, non-binary, and gender non-conforming folks, it is referring to care that allows us to feel safe in our body, because the care that we are receiving does not necessarily align with the gender that we were socialized as or the sex that we were designated at birth. Intersex and DSD folks can also receive gender affirming care. The care that intersex and DSD folks may receive can be different depending on what intersex or DSD traits a person has. So, what are the different types of gender affirming care that people can get? I tend to group them into 3 different categories. Now, the categories that I am grouping them into are not necessarily how everyone will group them. However, the types of gender affirming care that I'm about to mention are all the standard of care for gender affirming care for trans, non-binary, and gender non-conforming folks. Everyone with me so far? Fantastic. So the 3 categories we're going to be grouping our gender affirming care into are endocrine, surgery, and other therapies. So let's talk a little bit about endocrine first. When we talk about endocrine, that has to do with the hormones that are in our bodies, and it doesn't just have to do with sex hormones. The endocrine system also has to do with things like insulin, okay? That helps us absorb the sugar that we are taking into our body. It has to do with things like growth hormone, which helps our bodies grow as we get older. So the endocrine system is not just about sex hormones like testosterone and estradiol. The endocrine system is really big and has a lot of different hormones and processes involved in it. But when we're talking about gender affirming care for trans, non-binary, and gender non-conforming folks, there are generally 2 categories of care that we think about. We tend to think about puberty blockers and gender affirming hormone therapy. So puberty blockers are given to transgender adolescents before they undergo the puberty that you would expect to see given their designated sex at birth. So essentially, this just literally blocks them from having puberty. So when you give a trans, non-binary, or gender non-conforming adolescent a puberty blocker, the effects are reversible. So if you take them off the puberty blocker, they can undergo puberty. The effects are reversible. It's not going to stop them from, having a functional reproductive system or having a functional endocrine system. Puberty blockers are not dangerous, and we have evidence to support that. Gender affirming hormone therapy is slightly different, but we do also know that it is not dangerous and hasn't killed anyone. So gender affirming hormone therapy is given to anyone who has already undergone puberty or who has been on a puberty blocker and has past the point at which they should have undergone puberty. There are 2 general categories of gender affirming hormone therapy. There is estrogens, or E, and testosterone, or T. Estrogens, or E, are typically given to trans femme people to give them more feminine characteristics. So this would help them with breast development. It would help them have less hair growth. It would help them have a more feminine facial structure. It won't necessarily make their facial structure entirely feminine, but it can help with that a little bit. Testosterones, or T, are typically given to trans masculine people to help them develop more masculine features. So this can be things like deepening their voice, helping with hair growth. Effects on the reproductive system are reversible, and that's actually something really important to talk about. We're gonna have a side tangent. So specifically for testosterone, it is so important to recognize that testosterone is not an effective form of birth control. While a lot of people who go on testosterone do not menstruate or have a period while they're on testosterone, they can still get pregnant. People who are on testosterone do not become infertile. They do not lose their ability to become pregnant unless they choose to have a hysterectomy or oophorectomy, if that's something that they need or want as part of their gender affirmation or for a different medical reason. But testosterone alone does not prevent people from getting pregnant. Testosterone is not an effective form of birth control. Okay, and side tangent. So those are your two general categories of gender-affirming hormone therapy. There are different ways to administer both. You can get patches, you can get pills for estrogen, not for testosterone. There's a gel for testosterone. You can get injections for both of them. There's lots of different options in terms of administration, and it's both about getting the dosage that is right for your body and also finding a way to administer it that works best for you. So that's a conversation to have with your provider. So that's our endocrine category. The second category is surgery. So gender affirming surgery, and I'm going to make this very clear. Gender affirming surgery is usually not available to anyone under the age of 18 in the United States. Apologies, I am a student in the US. I don't know the laws in other countries. But in the US, it is very rare for anyone under the age of 18 to be able to access gender affirming surgery. I'm going to give a content warning for mental health and mention of suicide. If you can't listen to this part, skip ahead to this time point. Typically, the only time that someone under the age of 18 would be able to access gender affirming surgery in the United States is if they are experiencing so much dysphoria that they are at risk of harming themselves, harming someone else, or ending their own life. And in those rare cases, that's when someone would provide a gender affirming surgery to someone under the age of 18. Typically, the only surgeries that are done on trans youth under the age of 18 are gender affirming top surgeries. Usually they do not do gender affirming bottom surgeries on anyone under the age of 18. I do want to point out two important caveats to this. One caveat is that there are children's hospitals across the US that do perform gender affirming surgeries. However, a lot of the children's hospitals in the United States do see patients up to age 24 or 25. So the majority of gender affirming surgeries that they are performing are actually on patients between ages 18 and 24 or 25. They are very rarely performing gender affirming surgeries on patients under age 18. And again, it's only in those very rare, extremely life-saving situations that they perform surgeries on patients under age 18. Cool? Okay. The other important caveat to this is that there are people with intersex and DSD traits who have had these same exact surgeries without their assent and without their knowledge. Sometimes it is when they are born, sometimes it is within their first couple of years of life. There are some surgeries that are medically necessary. However, there are still surgeries that are performed on intersex and DSD infants and children that are not medically necessary. And those infants and children do not have a say. So that is something to be very mindful about when we talk about gender affirming surgery, because the same surgeries that trans youth do not have access to are being performed on intersex and DSD youth without their knowledge. That is a big conversation in the intersex and DSD community. We'll get into that more another time, but that is a really important caveat to mention here. So there are many different types of gender-affirming surgeries. There are top surgeries, which is either the removal of chest tissue or the augmentation of chest tissue. Typically with augmentation, you have to be on estrogen for, I want to say it's a year before you can get an augmentation. I'll fact check myself on that. But you do have to be on estrogen for a certain amount of time before you can get a chest augmentation. For chest reduction, you don't have to be on testosterone at all to get a chest reduction. So the reason there's a difference there is because with chest augmentation, you can get some natural chest growth just by being on estrogen, because every person has breast tissue, regardless of what sex you were designated at birth. If you're on estrogen, you're more likely to develop that tissue. So if you are on estrogen for the recommended period of time and you still don't feel affirmed, that's when you can get a chest augmentation. With top surgeries involving removal of chest tissue, that's a little bit different. There's no hormone that can shrink chest tissue. Like, once it's there, it's there. You can't get rid of it without surgery. So if you were, for example, designated female at birth and you feel dysphoria around your chest or don't feel euphoria around your chest, the only way to fix that is to either have a chest reduction or a mastectomy. Those are the different types of top surgeries. There are different types of bottom surgeries that you can have. There are a variety of bottom surgeries that people can get. There are masculinizing and feminizing bottom surgeries, and there are different options for both. It really depends on patient preference and, again, what each person's medical situation is and what each person's body anatomy is like. There are also facial surgeries, vocal cord surgeries. There are hair surgeries that people can get. That's a pretty new one that I was not aware of until Elle Duran came out and talked about her surgery. There are so many different kinds of surgeries out there. To be honest, I'm probably missing some, but in general, those are the big categories of gender-affirming surgery. The last big category of gender-affirming care is kind of the miscellaneous group. So this involves vocal therapy or speech therapy, which can help people with making their voice deeper or higher depending on what's more affirming for them. It can help people who may have been like a vocal performer or a singer prior to going on hormone therapy and may want to return to that but have a hard time. There's laser hair removal therapy for people who may benefit from that. There's lots of other interventions that can help people to be affirmed in their gender. Those are the main aspects of gender affirming medical care. There's also social affirmation, which is a really important part of each person's gender affirmation. This can involve, a person cutting their hair, changing their clothes, wearing makeup. It involves being affirmed by the people around them. It involves being called the correct name and being referred to using the correct pronouns. And by correct, I don't necessarily mean their legal name. I mean their chosen name, the name that they ask you to refer to them by. There's a whole lot involved in social affirmation that we'll talk about another time, but that is a really important part of affirming care. It's not just about the medical affirmation part. So to transition to talking a little bit about how this fits into medical care more broadly, regardless of what specialty you work in or choose as you're going into residency, or if you're going into nursing, or if you're a PA, whatever it is that you do in healthcare, regardless of which part of healthcare you work in or what specialty you're in, you will have trans patients. You know, it's not like trans patients just get our gender affirming care and then we leave. Like, we still have basic medical needs. We still have to go to the emergency room. We still have chronic illnesses. We still get cancer. We still have diabetes. You know, we still have the same medical issues that everyone else has. And it's important to acknowledge that you will have trans patients regardless of what specialty you're in. So knowing about the basics of gender affirming care, understanding how gender affirming hormone therapies and gender affirming surgeries work, and being able to have that information going into an exam room so that your patient doesn't have to explain it to you and your patient actually feels safe and comfortable with you is so important. There's a phenomenon called trans broken arm syndrome. We'll talk about that in a separate video. But trans broken arm syndrome is basically when a trans person goes in to receive healthcare that is not at all related to their gender affirming care or their being trans, and their transness ends up becoming the entire focus of the visit. So instead of actually getting care for what they went in for, they end up just talking about being trans. Not because they chose to, but because their provider chose to focus on that, or their provider didn't know what being trans meant and ended up asking them questions about it the whole time. To be more specific about trans broken arm syndrome, a lot of times what happens with trans folks is their gender affirming care, or even their transness, like them just being trans, is blamed as the cause of whatever medical issue they're presenting for. And the reality is that that's not usually the case. We are complicated bodies. Everyone is a complicated body. No one's body is exactly the same. We still have medical problems. We still have things we need to go to the doctor for. We are not just going to the doctor because we are trans and need gender affirming care. There are so many reasons that we need to go and see medical providers. And to have our gender affirming care or even our transness blamed as the reason for our problems both breaks trust with us, and it doesn't help us actually figure out what's wrong with us. So, with all of that being said, I hope this was a helpful introduction to gender affirming care. Thank you for tuning in. I love and appreciate y'all. Thank you for being here, my rainbow joys, and I will see you in the next video. Bye!